we are together with the chairman of the Working Group 2, which is focusing on dental biofilm-induced gingival diseases and gingival enlargement, and also the risk factors associated with the gingivitis. So we have Professor Mariano Sanz with us and Professor Wim Teughels. And I'm going to start with you, Mariano, and I want to ask you to give us an overview about the main topics discussed in your working group and the key objectives you are having after the completion of all those conversations.
Well, our working group had basically two main remits. One is to identify whether there are systemic or local risk factors that influence gingivitis, and how we recommend the dentist to treat gingivitis when there is presence of these specific risk factors. And on the other part, the other second remit is how to manage gingival enlargements. And these gingival enlargements, of course, may have different causes. So we have analyzed the causes, and we have analyzed how to manage these enlargements. Some of them are medically related, so we need to be in very close cooperation with the physicians. Some of them are more dental related, and therefore there we need to basically prioritize different managements, starting from the less invasive to the most invasive.
Great, we'll come back to the gingival enlargements, but first go to the risk factors, to Wim. Could you tell us which local or systemic factors actually stood out during the conversation in the working group?
What came out was that it's much more than just like accumulation as such. The ones that really stood out were malalignment of teeth, and basically everything what is plaque-retentive. So also orthodontic appliances were one of these factors that came out of as being significant for gingival inflammation or increase in gingival inflammation. So it's a wide variety of factors that at the end can be treated or can be resolved in order to improve oral hygiene and gingival health.
Right. So there were a lot of challenges in that discussion.
It was challenging indeed, because the literature is often not there or is difficult to interpret. But at the end, we managed, I think, to create some clear guidelines for the clinical practitioner on what to do in these cases.
Thank you very much. Gingival enlargement is a very important issue in everyday clinical practice, at least in periodontology. And I would like to ask if you have any particular steps the clinicians should follow in order to treat them or to control them.
Sure. I think it's very important to identify the main predisposing factor for the enlargement. We have identified key ones like drug-influenced enlargements. And in this situation, we are talking about a medical condition that needs medication, which are influencing the clinical enlargement. And therefore, the change of the drug is critical for the management. And we cannot change the drug, but we need to get in touch with the treating physician in order to suggest that the drug is removed. Because in most of these situations, when the drug is removed, the enlargement significantly decreases and sometimes even disappears. So the oral management is heavily dependent on this drug management in these particular drug influence enlargements. There are other predisposing factors. We come back to the orthodontic appliance, probably one of the most frequent ones that lead to enlargements. And we even have discussed some hereditary fibromatosis, which is a genetically driven condition that leads to very extensive enlargements. So we have more or less prioritized the treatments depending on the severity of the enlargement, but of course always starting with oral hygiene, with motivation to remove the plaque, with PMPR if the enlargement is not very relevant, or if we have deep probing depths, mostly pseudo pockets, of course, we will need to do first subgingival instrumentation, and if it does not recede appropriately, then surgical excision. So we have basically tried to make a logical pattern of recommendation to treat these enlargements.
And now you said you start with a very detailed medical history of the patient in order to find all the confounders and the factors. So I think it was very, very detailed. Thank you very much, and I wish you all the best results from your workshop. Thank you very much.
Thank you.